Christine Cornels, and we have a great show for you today with Top of the Morning. Thanks for joining us. Welcome back. We're with Dr. Maureen Black, one of the inductees to the Maryland Women's Hall of Fame. Dr. Black, thank you so much for being with us.
No, thank you. I'm delighted.
Yeah, and congratulations, too, on receiving the award.
Oh, it's really quite an honor. I'm absolutely thrilled.
You're joining a group of austere women.
Yes, very austere women, yes.
But I read a little bit about your bio. You are a pediatric psychologist.
Yes.
Involved in intervention research. Can you tell us a little bit about what that is and what you do?
Yes, thank you. A pediatric psychologist means that I'm interested in children, and specifically I'm interested in how children's health and development is related to potentially illness. And so I've always worked in a medical center. So we work with children who have health issues sometimes, and we think about their development and about their behavior and how to maximize their behavior and development, even if they're confronted by health issues. The health issues that I work with specifically are nutritional ones. So, for example, in Baltimore, I direct a clinic for children who are not growing well. Those are kids whose growth is below the growth curve. And I do research trying to prevent childhood obesity. So trying to promote healthy growth and development among children.
That is a difficult challenge in the United States. And Dr. Black, we're here because she's going to be inducted into the Maryland Women's Hall of Fame this evening in March in the month of Women's History. And we have some people talking in the background who are gathering and preparing for the event. So we'll try. Hopefully the mic can pick us up enough over the din of the people joining us. But Dr. Black, thank you for explaining that. And what are some of the things that can be done to prevent obesity in children and some of the other issues that you were talking about?
You know, it's quite fascinating, but some of the same practices that we would advocate that would prevent obesity would also prevent failure to thrive or growth failure on the other end. And some of those practices begin very, very early in life, some actually before children are born, in terms of the health and nutrition of women while they're pregnant, such practices as breastfeeding, and then thinking about a child's diet and activity from a very, very young age so that children have healthy options, particularly in the first year of life when their growth is so rapid and their nutritional demands are so high. So that if you start off with children, introducing them to healthy foods, healthy portions, and not using food to manage behavior, then you're fine. Then you're not behind and trying to reduce or be emotionally involved with food subsequently.
Which is really easy to fall into those bad patterns, I imagine.
We're confronted by bad patterns and confronted by portion sizes that are way too large, and they're the kinds of things that children unfortunately get used to. We all get used to.
Right.
So there's lots that you can do to promote good habits before bad habits get instilled.
So you've been able to see some successes from some of the
We do. We are able to see successes. So we help children who are too small get onto a healthy track, and we prevent children who are at risk for becoming overweight stay on a healthy track as well.
Wow, and how did you get into this area? Because I think if I remember right, your background, you started out in mathematics, and then it's lots of twists and turns, and what happens is, it's very hard to predict where life will take you. So I did. I started with an undergraduate degree in math, which I loved, and I worked for IBM as a systems analyst for a while, and I did that in Philadelphia and London and Los Angeles and New York. And what happened is I knew that someday, whether I liked it or not, I would be a 50-year-old woman and I would be working.
And I didn't find role models. That I couldn't see anyone who was working at that point it was IBM, who was 50 and doing what I wanted to do. So I made a switch. And the switch was I moved to occupational therapy, and then I moved to psychology. I was fortunate to be able to return to graduate school and to switch. I discovered nutrition as it were, and I discovered the relation between children's nutrition and their intellectual development. And so I became very interested in that. I then had the opportunity to live in Bangladesh and live in Peru, and in both of those places, children's nutrition is a major issue. And so I became interested in those, and then when we moved to Maryland, I was able to develop a growth and nutrition clinic for children of Baltimore who are not growing well. And that has continued. When the obesity epidemic came along, or we became aware of it, as I said, there's some of the same healthy practices that prevent failure to thrive also prevent obesity.
So when you were back as an analyst and looking forward to seeing women who weren't doing exactly what you were interested in, now looking back to when you were an analyst, do you feel like you are doing then what you are interested in?
I love what I'm doing.
Do you? Yeah.
Oh, absolutely. It's a lot of fun. That I think one of the most exciting parts is that I have colleagues all over the world. And so that's really very interesting. It's been helped, by the wonderful advances in technology, so that you can. I have a conference call with colleagues in India every week. They're 10.5 hours ahead. So for us, it's 7:30 in the morning, 7 o'clock in the morning, and for them, it's 5:30 in the afternoon, and it works.
It's wonderful.
It's wonderful. It's
Share
not
information
expensive.
quickly.
Exactly.
Yeah.
So that you can have colleagues any place in the world, and that's very exciting. And you can work on issues that are relevant in Baltimore or relevant in India.
And for those of us who aren't involved in this world, is there anything that we can be doing or should be thinking about in terms of the health of children in our communities?
There are many environmental threats to families and to children. Danger, violence is one of the threats. So it makes it hard for children to be physically active if they can't be safe. So some of the things that we can do is to try to make our communities safe so that children can play outside.
Right.
Yes.
And it's interesting. The rest of us don't necessarily think about the linkages between each of those factors. One more question, just wanted to ask you for our viewers. What advice would you give to women who are early in their careers and thinking about their future?
Well, let me think. I think there are probably at least 3 pieces of advice. One that I've mentioned is to have a mentor, to have mentors. And that is people that you look up to and you can check in with, and who will give you an honest appraisal or honest answer. So it's useful to have a mentor. Another one is to have a balance in your life. And the balance varies for people. For many people, it's a balance between family and profession. But to have a balance is helpful. And probably the third one is to trust in yourself, and that if you think things are going a direction that you would like to change, to work to change it. So to have confidence and trust in yourself.
Wow, we'll appreciate that. Dr. Black, thank you, and thank you so much for being an inspiration to future women leaders, and congratulations on your award again tonight.
Thank you, Christine. My pleasure.
Oh, and we'll be right back.
Thank you, Ms. Coleman. It is my great privilege as president of the University of Maryland, Baltimore, to introduce one of our esteemed faculty members as she is inducted into the Maryland Women's Hall of Fame. Our youngest, most disadvantaged citizens have a tireless advocate in our state of Maryland, Dr. MAUREEN Black. She has dedicated her life's work to improving the nutritional care of women and children in need. And I can think of no one more deserving of this honor. Dr. Black is the John A. Scholl and Mary Louise Scholl Professor of Pediatrics at the University of Maryland School of Medicine. There, Dr. Black teaches and mentors medical students, residents, and postdoctoral students to go out and take care of the world. She also has appointments as professor in the Center for Human Nutrition at the Johns Hopkins Bloomberg School of Public Health and the Department of Psychology at the University of Maryland, Baltimore County. She is a pediatric psychologist, and she received a bachelor's degree in mathematics from Penn State University, a master's in occupational therapy from the University of Southern California, and her PhD in psychology from Emory University. At our School of Medicine, Dr. Black directs the Growth and Nutrition Clinic, a community clinic for needy children that serves families from across Maryland. She's also a world-class scientist, and her groundbreaking research on factors that affect child development has had an impact on nutrition, food, and child development programs worldwide. Dr. Black and her colleagues have created a number of innovative interventions to improve children's health and well-being, including an obesity prevention program targeting urban African-American adolescent girls, a program to provide direct interventions for children who are at risk for growth problems, and a program to prevent excess weight gain in toddlers from low-income families who receive women, infants, and children WIC services. In fact, Dr. Black is currently chair of the WIC Program Advisory Committee for Maryland. So I cannot overstate what an incredible contribution Dr. Black has made toward promoting the well-being of women and children, not only in the state of Maryland, but globally. And I applaud you for recognizing and affirming the scientific and public health contributions of this outstanding scientist and humanitarian by installing her in the Maryland Women's Hall of Fame. Ladies and gentlemen, Dr. Maureen Black.
Thank you very much. Thank you, Dr. Perman. Dr. Perman has been my mentor and my hero for many years. I certainly applaud the commitment that he has made as a pediatrician to the health and the well-being of children and families throughout Maryland. And also his leadership as the president of the University of Maryland, Baltimore, ensuring excellence in training and in service and in research. I'd like to thank my wonderful husband, Bob, and our two daughters, Shanti Taylor and Marisa Weems, both of whom will deliver babies in the next month. Pretty exciting. In this Women's History Month, I want to acknowledge two very important groups of women. One group represents the leaders of tomorrow. Like our daughters, these are the young women who assume professional roles, they balance career and family, and they strive to make our nation and the world a safer, friendlier place for all of us. I have the honor to work with many of these women at the University of Maryland in healthcare. And I can tell you that we are in for a treat. That these women are a strong force. They will lead us well, make us proud, and take care of us in our old age. There's another group of women that I'd like to talk about. These women are just as strong, but their opportunities are limited. often by their fate of being born into low-income circumstances with limited opportunities for education or professional advancement. These women are often beset by health disparities, and in the cycle of life, they become mothers of vulnerable children. As a pediatric psychologist, I work with many of these families in downtown Baltimore and globally. And I have learned by working with them that we tried both clinically and through our research efforts to develop strategies and programs and policies that enable women, regardless of their circumstances, to thrive and to enable their children to thrive and become happy and productive citizens. There are many, many commonalities between these two groups of women. They're quite striking. They're guided by their passion for children, their passion for life, and by their care of humanity. They're guided by wanting to have a better future. And so the challenge for us all is to marshal the enthusiasm and the strengths of these groups of women to make a happier, healthier life for all of us. So I leave you with a Chinese proverb, and that is, if you want to go fast, go alone. If you want to go far, look for colleagues, build a team, and go in unity. Thank you.
Well, we hope you enjoyed the show today. It's been so wonderful to be able to meet these distinguished women. I'm glad to be able to learn something from them myself, and I hope you did as well. Keep tuning in, and we will see you next time.